Hello, thank you so much for finding my talk, Care of the Broodmare. So I will just take a moment to introduce myself, although probably you already know me if you found this talk. But I graduated from the University of Liverpool. I spent 2 years working in New Zealand. Then I worked at Bellevue Veterinary Clinic in Somerset. In 2020, I decided I wanted to get more experience with stud medicine and took a 6-month position at Newmarket Equine Hospital, followed by a 6-month seasonal job in the Southern Hemisphere at a branch of Scone Equine Hospital. And then I worked again at Bellevue Veterinary Clinic, where I am currently. And during the last 3 years, as well as working full-time, I have studied for an advanced qualification, the Certificate of Advanced Veterinary Practice, and I passed an exam at the end of that, specifically in equine stud medicine. So I wanted to begin with conception. Cyclicity in mares is linked to day length. The hormones are released in response to decreasing melatonin. Melatonin is a hormone produced during the hours of darkness. It is also key that the mare is on a rising plane of nutrition. Obesity negatively impacts fertility. It's very inflammatory and is something you want to avoid. However, poor body condition also negatively impacts fertility, so you need to get the balance right. You want your mare to not be fat coming out of winter, and you want her to be putting on condition, but you don't want to be at either extreme of the scale. And you want to consider when her last foal was weaned, if she has had a foal before. So just to expand on the cyclicity being linked to day length, mares are long day breeders, which means they usually breed during late spring, summer and early autumn. The correct term is seasonally polyestrous breeder, and that means that they have a cycle, an estrus cycle. Many is the poly part, so they have many cycles, but they only have them during the breeding season, so seasonally polyestrous breeders. This is an evolutionary mechanism to ensure the best conditions for offspring. Excuse me. So basically the mares, the whole point is that they will have their foals when there is increased grass growth and the grass is more nutritious and the weather will be better so they can see predators and the foals are more likely to survive. So this is a very well thought through evolutionary mechanism which we humans like to interfere with at times. Think mainly the thoroughbred industry. Excuse me. So once she's in foal, you need to think about how long she's going to be in foal for. So normal gestation length in a mare is very variable. It's between 320 to 360 days. 1% of mares will actually go 1 year or longer. If the foal is born before 320 days, that can be very serious and the foal is classed as premature. If your foal is born at full term but is behaving in an immature way or has physiological characteristics of an immature foal, then the correct terminology is immature or dysmature. So what I do for my clients is I use the website from the horse foal gestation calendar, and I put in the date the mare was bred, and then it gives me an estimated foaling range, which I find much more helpful than a due date because in my experience they're not going to be exactly at 344 days. So I give my clients that date and I tell them the signs to look out for, and I find that's the most successful way of doing things. Excuse me. So a mare can be bred from 2 years old, but that's not really what I would advise. You want to wait till she's skeletally mature. And the peak fertility is around 6 to 7 years old. Fertility does start to decline from 15 years old, and that's particularly serious or worse if she is a maiden. If she's had foals prior to being 15, it's a slightly better outlook. So the reason why it could be worse to have a maiden at 15 years old is that her uterus could have fibrosed because it's never developed a placenta, and her cervix could be quite fibrous because it's never had to fully dilate to let a foal out. And that means that sometimes during the breeding process she might accumulate a lot of fluid, and because the cervix is very fibrous, it can't drain out. So there are things we can do to get around this, but it's just worth bearing in mind that you might have a slightly tougher battle on your hands with an older mare. If you're told your mare has, okay, well, she's definitely fertile because we've had foals from her via embryo transfer, well, that does prove that she can ovulate, but it doesn't help the uterine lining or the cervix issue. So if you do have an older mare, the chances are that your mare will need a small procedure called a Caslix. The full name is a Caslix vulvoplasty. It's a very simple procedure that's been around since the 1930s. And basically the premise is that for a mare to become pregnant and carry a foal, her uterus must remain sterile or free from infection. So there are barriers to prevent any bacteria getting into the uterus are the vulva, the vestibulo-vaginal seal, and the cervix. So if age or poor conformation, weight loss or injuries can cause any one of these barriers to fail. So the Caslix focuses on improving the vulval seal, and it's a procedure done under local anaesthetic and involves placing some stitches which will then be removed 14 days later. And the Caslix will be in place throughout the pregnancy. When the mare is close to foaling, it then must be opened by a veterinary surgeon, in a sterile fashion with local anaesthetic, ensuring cleanliness and accuracy. What you don't want to happen is to forget about the Caslix, let the mare start foaling, and then have to open it in a hurry because it won't be as accurate, or even worse if you don't remember and she tears. So you must remember that if your mare has a Caslix. So to talk about nutrition, which is really important, and I think this is something where you need to get the basics right. The main message is you need to get good pasture, good grass and good forage, and you won't go far wrong. So for the first 7 months, you generally need to feed to maintenance requirements, which is pasture, forage and a stud balancer. Then in late pregnancy, 8 to 11 months, the foal is rapidly growing and therefore there is increased calorie need. Again, there is an increased calorie need during the first 4 months of lactation. However, after 4 months, the need for increased calories really drops off. So my message would be to focus on the pasture and the forage and then adapt it slightly towards the end of pregnancy and during lactation. And that brings me nicely on to my next slide, because good dental care and appropriate parasite treatment will maximise the results from your feeding. So routine and preventative healthcare is so important, and it's actually really simple, but do not forget the basics. So there is a huge increase in weight during pregnancy, and this puts pressure on the hooves. It's important to make sure they're in great shape. If a mare has foot pain at the end of her pregnancy, she will spend more time lying down, and she needs to be able to get up and down as she wants in the last few weeks to help the foal get in the optimum position for delivery. So a 600 kilogram broodmare might put on 90 kilograms during pregnancy, which is a lot. So that's a 12 to 15% increase in her body weight. And you think, the hooves are going to be taking the brunt of that. So really don't neglect regular foot care. And the same goes for dentistry. So with women in the UK, when you're pregnant, you're entitled to free dental care, because any bacteria in your mouth can travel all around your body, and in pregnant women with periodontal disease are 7 times more likely to either have a miscarriage throughout the pregnancy or have a low birth weight child. So it's so important to have good health, good dental care during a pregnancy. So with broodmares, a proper examination, understanding sedation with a head torch is what I would advise. Floating or just rasping the teeth is not enough. You need to be really assessing the periodontal tissues and all the soft tissues in the mouth. Periodontal disease is found in about 60% of horses over 15, so it's really common. And a huge amount of bacteria can then end up in the mouth, travelling throughout the bloodstream and then going to the placenta and affecting the foal. So it is really crucial to take dentistry seriously. So parasites, their life cycle is really affected by the weather and the climate, but with climate change, the patterns in our seasons are becoming less clear, and so the old patterns of when we knew when to give wormers are also becoming less clear. And coupled with this, we're not getting any new wormers, so we need to conserve what we have, because it takes years and years to develop new wormers and bring them to the market, and there haven't been any new ones for about 20 years. So overuse of the ones we have is causing resistance, and they're becoming less effective. So what we really need to focus on is working out whether the horse actually needs a wormer or doesn't. So 20% of horses will carry 80% of the burden, and good management is essential. So that involves regularly cleaning the foaling boxes to prevent the build-up of any parasite eggs, particularly Strongyloides westeri, which is one of the parasites that can travel through the mare's milk and infect the foal from day one. Do not overstock paddocks or barns, and do not use the same paddocks for foals as you are your yearlings, and definitely try and rotate them, because your yearlings will again have probably the highest amounts of parasitic burden, so you don't want them in the same paddocks as your foals. And remove the dung from the paddocks. So yeah, the take-home message is we need to be moving towards testing and worming when required, rather than just blanket worming. So if you want to test, what you really need to do is a worm egg count every 3 months, and then the rest of the year that will assess your strongyl burden. But unfortunately, the tapeworm don't shed their eggs as reliably as the strongyls. So if you're just relying on a worm egg count, you might miss a tapeworm burden. However, we have got the saliva test, which picks up antibodies to tapeworm, and that can help guide you on whether your horse needs a tapeworm wormer. And we also have the blood test, which tests the antibodies against the larval cyathostomes, the small red worms, because again, those parasites aren't shedding eggs, so they're not going to be picked up in the worm egg counts. So you really need to do worm egg counts, saliva test, and the blood test. So if you're doing those, what you need to be then doing is, based on those results, probably a moxidectin and praziquantel wormer in late autumn, early winter for the tapeworm, the encysted, and the strongyls. And then an ivermectin during the last month of pregnancy if you haven't recently treated with ivermectin and you have had previous problems with the Strongyloides westeri. But those are sort of the general principles, but I'm very happy to talk about individual scenarios and try and reduce our reliance on those where we can if we know the mare has a very low burden. The next crucial part of routine broodmare care is their vaccinations during pregnancy. So influenza and tetanus booster within 6 weeks of the expected foaling date. This will help boost the antibodies that she'll make in her colostrum, and the foal will get protection via that colostrum. And then equine herpes virus, EHV-1/4, at 5, 7 and 9 months gestation. That's been the industry standard for years. However, progressive studs are now also vaccinating at 3 months to try and reduce the likelihood of an abortion storm. And they are also vaccinating all horses on the property every 6 months against EHV 1 and 4. And that's in the code of practice from the HBLB, which all stud managers can have access to if they're part of the Thoroughbred Breeders Association. And then rotavirus at 8, 9 and 10 months for pregnancy. And the message I'm going to give you is that prevention is better than cure. If you haven't had experience of these diseases, you might be tempted to question the necessity of vaccinating. So I thought I should just expand a little on each of these diseases to help illustrate why prevention really is better than cure. Vaccination doesn't promise you won't get the disease, but it will reduce the severity. So the thoroughbred industry is hugely impacted each year by outbreaks of influenza. So the Horse Race Betting Levy Board, HBLB, fund the Equine Influenza Surveillance Scheme, which enables a free of charge PCR test for suspected cases of flu. And you also need to make sure your mare is fully vaccinated if she's going to be going and visiting a stallion, because different studs will require boosters very frequently, before they'll let you on the premises. So an outbreak of flu will look like an elevated body temperature, dry cough, wheezing, inappetence, fatigue, and it is much more serious in foals and can cause lung damage, which could impact future athletic potential. Tetanus is a really horrible disease. It's a bacterial infection. The bacteria produce toxins that affect the horse's nervous system, and you might have heard it called lockjaw, because as the disease progresses, the mouth clamps shut and the animal cannot eat or drink. Usually it's fatal, especially once the horse is recumbent. Normally there's not much you can do. It's far easier to prevent it through vaccination. And then rotavirus damages the lining of the intestines and inhibits digestion and absorption of food. It's actually the most common cause of diarrhea in foals less than 6 months, and you really don't need much of the virus to cause disease. So you really need to, as well as vaccinating, you need to really keep the foal pens clean. Okay, so we've covered the preventative vaccinations and preventative healthcare, and you'll probably want to know, when is my mare going to foal? Well, 86% of mares will foal at night, mostly between 10 p.m. and 2 a.m. And that's again an evolutionary mechanism, nature's way of choosing the safest time away from predators. The foal determines the day, but the mare determines the hour. So when she's feeling safe and comfortable, that's when she'll probably get on with the foaling. The udder will start to develop 3 to 6 weeks prior to foaling. If you're noticing the udder developing 2 months before the expected foaling date, that could be an indicator something is wrong and she will require a veterinary examination. You'll also see the ligaments and around the tail head softening, and you might see almost like candle wax on the end of the teats, which is called waxing up. and that occurs in about 95% of mares 6 to 48 hours before foaling. You can take a little sample of the colostrum and check the chemical makeup of the milk, and that will also, the electrolytes switch just before she's due to foal, but I don't usually like that method because I don't want to encourage anything to make the milk run or to make her uncomfortable around her udder before the foal is born. You can monitor the body temperature because there's a drop in body temperature the day before foaling. So as well as that, you can use different alarms and CertAVP. The one on the left is a transmitter, so the vet stitches a transmitter into the mare's vulval lip 8 to 10 days before foaling, and then during the birth a small magnet is pulled out from the transmitter which sends a signal to the radio signal to a receiver and activates an alarm. So there's different things you can do if you really don't want to miss the action. Okay, so I thought we'd just do a quick recap of the actual stages of labour. So 1, 2, 3. Stage 1 is the initial uterine contractions. She's going to be pretty uncomfortable, lying down, getting up, sweating, walking the paddock, and this can last anywhere between 5 minutes and 3 hours. So the foal is turning from lying on its back, where its backbone is next to the mare's backbone with its head facing the tail. The cervix is beginning to dilate, and the first stage of labour ends when the membranes rupture, the waters are breaking. The second stage is when the foal is delivered. So these are really strong, forceful abdominal contractions. The foal's feet are at the vulva and one foot in front of the other and the head between the knees. It should be less than 20 minutes. So it's explosive. It's really strong contractions, and there's progress being made with every contraction. And stage 3 is expulsion of the placenta. This is a really important part, and it could be within 10 minutes or it could be within 3 hours. If it's still retained after 3 to 6 hours, you need to see, a vet examination, and actually even sooner in draft breeds, because they're really susceptible to infections if the placenta is retained. Okay, and then after foaling, you need to check, is she comfortable? She may require pain relief. If she needs to be comfortable in order to allow the foal to nurse, but you don't want to interfere unnecessarily. You need to allow the mare and foal to bond, and you don't want to be getting between the mare and her foal. And then lactation. Is there anything on the udder that's going to prevent the foal from latching? The picture shows a sarcoid next to the teats, which could cause a bit of confusion. Has she previously had mastitis and there's fibrosis in the udder and not going to be producing much milk? Is she a maiden, not making much milk? In which case there are different medications we can give which can help increase supply, starting with domperidone or oxytocin. I've often heard stud managers tell me they put cocoa powder in the feed. I don't think it does any harm, and it might help. And also just the normal behaviour of a foal feeding little and often will stimulate her supply to increase. I always put this slide in because people need to know when to call the vet around foaling. So if you ever see a red bag around the vulva, this is an emergency, because it means the placenta has prematurely separated and the foal is not receiving oxygen. So you need to get that foal out so it can breathe air and receive oxygen that way, because the placenta has already detached and it's no longer getting oxygen via the bloodstream of the mare. So if stage 1 is longer than 3 hours, if stage 2 straining is going on longer than 15 minutes and you're not getting progress, if you've got a white bag but no body parts, if she's not straining, if she's only got one hoof at the vulva, if the hooves are upside down or above the nose, or there's a head with no hooves, or the tail is presented. Okay, and then just on to broodmares. We need to never underestimate them. You need to have appropriate facilities if you're thinking of breeding your mare, and you need to not underestimate them with other horses or with yourself and personnel, just for everyone's safety. So I always put that one in there because I think people think, oh, she's an old broodmare, but they're forgetting that they're just really underestimating them. So don't make that mistake. Wow, that's a bit of a whistle-stop tour of care of the broodmare, and thank you very much for listening. If you found the talk useful, please make a donation to the Wiltshire Air Ambulance. Thanks so much.